Is it arthritis? Is it the muscles? Is it the ligaments? Is it the tendons? Polymyalgia rheumatica. It's a big word, but can be treated. We'll be back.
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.
I'm Dr. Carrasco.
I'm Dr. Alex DeJesus.
We're talking about painful conditions. This condition starts generally in the shoulders, but can go to other parts of the body. It's called polymyalgia rheumatica. Alex, tell us about it.
You know, this is a condition of people in their over 50, not the young people. And I call it the Tin Man disease, like from the Wizard of Oz. So the Tin Man disease. These people are going to show up with very stiff shoulders that don't want to move. And very soon thereafter, very stiff neck that doesn't want to move, and very stiff hips that don't want to move. So this condition hits the large joints, hips, shoulders, neck, and it's very symptomatic. These patients feel absolutely terrible. They can't walk, they can't move. It causes a lot of stiffness and pain.
So when this is happening, the most common symptom, though, I understand it's supposed to be shoulders first. Is that right?
It could be shoulders first, but very, very fast thereafter, the hips and the neck are involved.
Fast, you mean like over months, over days,
over
or
a period
what?
of days, over a period of days.
So does this condition start fast or it starts slowly?
It's very insidious, very slowly. The patients kind of think that they just overdid something or exercised or did too much in the yard. Then the next week, the stiffness gets worse, and then they try some over-the-counter medications. By the time they see us, they're pretty symptomatic. They can't elevate their shoulders, and they can't move. They can't get out of the chair.
Tell me what's happening with the anatomy. You know, I see a lot of people with shoulder pain. It sounds like it's a really bad arthritis. How I want to distinguish that from this?
So clinically, the patient has a severe stiffness and decreased mobility of the shoulder. So when you look at them this way, they cannot elevate the shoulders, kind of stuck, or they cannot move in this direction. Okay, so elevation and moving in this direction is not very easy. It hurts. And then look for this on them. For their necks are stiff, they're like this, they don't want to move their neck, but the same thing that's going on in the shoulder is going on in the hip, and they can't barely get out of the seat. They're pushing off and they're walking. Now, you and I that talk about canal stenosis and disc disease and other things, we're thinking about all this differential. But what you do is you do an x-ray, the x-ray is going to say osteoarthritis. That's all it's going to say. But when you do a sonogram or an MRI, an ultrasound or MRI, then you're going to see tissue growing inside the shoulder, and that tissue doesn't allow the shoulder to move, and eventually is going to freeze the shoulder and not let it move anymore. So this is a very, very inflammatory condition that causes inflammation inside the shoulder. I like to do ultrasound because instead of sending them to MRI and bringing them back, I do it myself in the office, and right away I have a diagnosis.
All right, so you have a diagnosis. All right. In this situation, how do you treat it?
The patient's going to need to be on steroid therapy. There's no ways around it. You know, the patient's going to need to be on prednisone or something like it. It's a treatment of choice, and the patient's symptoms can go away. But if they come to see us and they're already having troubles walking, they're going to need some injections in their shoulder, and they're going to need some rehab therapy to get strong again.
So where do you put the injection?
The injection should go in the shoulder or the hip. In this situation, the shoulder, you can go below the clavicle.
Just kind of feel that knot right in there?
Right under that knot, below the clavicle, or if you want to go medial, closer to the chest and go to the humeral, you can definitely go in here. And the patient's going to have almost immediate relief. That shoulder pain does better, shoulder starts to move, and this is an excellent time to start them on rehab within a couple of days of the shoulder injection.
How long is the rehab process?
You're looking at a few weeks to feel much better, but a lot of these patients go off medicine and the symptoms come right back. You have a 50-50 chance of being on medicine the rest of your life or not.
Can it come back?
It can come back. If you stop the medicine, 50% of the patients are going to come back.
Thank you very much, Alex. It's a very important condition because it can be very painful, very debilitating. If you have these symptoms, please see your doctor.
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.